Hey guys, welcome back to my YouTube channel, The BDS Graduate. సో ఈరోజు మన టాపిక్ ఏంటంటే డయాబెటిక్ కీటోసిడోసిస్. ఇట్ ఈస్ ఆల్సో నోన్ యాజ్ డయాబెటిక్ కోమా, రైట్? కమింగ్ టు దిస్, ఫస్ట్ ఆఫ్ ఆల్, వాట్ ఈస్ diabetes mellitus? The diabetes mellitus, it is one of the chronic disorder or condition where the body that cannot effectively produces the insulin hormone. So what is the help of this insulin hormone? It decreases the blood sugar levels, right? But in the diabetes mellitus, the body that cannot produce the insulin hormone, so that leads to increases in the high levels of sugar in the blood. That is called diabetes mellitus. And coming to this diabetic ketoacidosis means it is the one of the complication of the diabetes mellitus. And it develops in the type 1 diabetic patient under mainly two conditions. The first condition is where we can observe it in the undetected or undiagnosed type 1 diabetic patient, and it may present in the ketoacidosis for the first time. And the second condition is the patient of type 1 diabetes which is on treatment with insulin, he may also develop it under the stress or infection or some other factors. So this diabetic ketoacidosis mainly seen in the type 1 diabetic patients only. And next, the hypoglycemia or the ketoacidosis that may develop rapidly and ultimately it may leads to coma also. And coming to pathogenesis, first one, the severe lack of insulin. So there it leads to lipolysis of the adipose tissue may occur. From the adipose tissue, free fatty acids are released into circulation. This fatty acid converted into ketone bodies. This ketone bodies that leads to formation of the ketogenesis, formation of more ketone bodies. All these are occur due to that lack of insulin only. So coming to its clinical feature, the first symptom is it is the abnormal vision, okay, not abdominal vision, sorry, and it is abnormal vision and the blurred vision and polyuria, nausea, vomiting and thirst mainly. So the signs or warning signs of diabetic ketoacidosis includes, the first one is dehydration and thus hypotension and cold extremities, tachycardia means increases in the heart rate, and coma, confusion, drowsiness and also peripheral cyanosis. So the complication of this diabetic ketoacidosis leads to hypoglycemia and hypokalemia means decreases in the potassium levels and also sugar levels, and as well as acute pulmonary edema. And the next one is investigation. So we may notice that the acidosis levels are less than 7.3 pH means increases in the acidity, and hyperkalemia and hyperglycemia with ketonemia, and increases in the creatinine due to the dehydration. So how we can manage it? The first step is correction of the dehydration by the IV fluids. So that IV fluid is normal saline. It is 0.9% 1 liter in 1 hour, and then 1 liter over the next 4 hours, and then quantity that is titrated. So mainly here we remember only two solutions. One is normal saline of 0.9% and the another one is insulin which we can give in the IV form. Okay, and the second one is correction of acidosis. So acidosis, it is corrected by the base. So here we using the sodium carbonate. It is one of the base, right? So 200 milliliter of H2O that is given in the place of normal saline till the pH it is becoming greater than 7. And the third one is use of the unmodified insulin, and the fourth management is replacement of the potassium, like 10 to 20 milli equivalent of the potassium per hour. The potassium chloride that is added for the correction of the hyperglycemia. And the fifth treatment is treatment of precipitating factors mainly such as infection or some other factors. If the infection is suspected, broad spectrum antibiotics are started. Okay, thank you for watching. Please subscribe my channel.